approximately 1.4 million individuals of all ages incur a TBI annually in the United States. Of these injuries, 52,000 result in a fatality. An estimated 2.5 million to 6.5 million people currently live with the effects and of surviving a TBI. Although more prevalent in individuals between the ages 15 and 24, TBI affects about 180 out of every 100,000 children under the age of 15. TBI is the leading cause of death and long-term disability in children and adolescents, with over 30,000 children a year being disabled for life as a result of having a TBI. Traumatic brain injury is among the most common cause of neurological disability in young adults. Damage after TBI frequently involves the frontal lobes, leading to cognitive defects associated with cognitive slowing in the patients. TBI patients frequently complain about the fact that concentrating on mental activities is abnormally tiring.
Our current study utilized a multimodal stimulus network, in which subjects were taught a large stimulus network, first through conditional discrimination, in which we build a stimulus class for that individual, and then we merge different classes of stimulus through class merging. We also tested for transformational stimulus function. Definition of transformation stimulus function is basically that a function of a stimulus that's in a derived relationship then alters the function of another stimulus that has not been trained. So we see that transformation of function occur between the stimulus without the intentional training, meaning no reinforcement was provided for that relationship, for that function to then transform to the other stimulus.
And now we have our participants. We ended up recruiting all three of them from a residential rehabilitation center that offers community-based care for adolescents with brain injuries. They were all given the incentive of a choice of candy bar if they finished our program, which they loved. A little bit about them: they were all raised within the foster care system. Timothy was a 12-year-old fifth grader whose brain injury came at birth from fetal alcohol syndrome and drug use from his mother. This is also the same for Carson, who is 15 and a sixth grader. Kevin was 17. He's a 10th grader who was dropped on his head as an infant. All of our sessions took place on site at the residential facility in the clinical building. We just used the main office that BAT uses there. It has a large desk, 2 chairs, a filing cabinet, and a Dell laptop, which of course was accommodated with Microsoft Windows XP and the Visual Basic programming software. This room was free of distractions. The client was seated at the desk facing the monitor, and they were to use the mouse pad to click answers.
We used a match-to-sample paradigm for training and testing each relation. Our baseline was the same as our testing phase. If they achieved 50% or higher to criterion on 2 or more of any testing blocks, they were excluded from the study. Training sessions used the words small, medium, and large as our samples, and the choice stimuli were small, medium, large units of measurement. The background color was blue when large was the sample, red when medium was the sample, and yellow when small was the sample. The 3 comparisons included distance as mile, yard, and foot, weight as ton, pound, and ounce, volume 1 as cup, tablespoon, and teaspoon, and volume 2 as gallon, quart, and pint. All sample and selection stimuli were presented randomly. Participants had to reach 90% to criterion on all trial blocks before moving on to testing. Participants also received 2 different auditory sounds upon correct and incorrect responding. Additionally, progress bars were visible for the participant to help discriminate how close they were to mastery criteria. Testing sessions looked at derived relations from the 4 trained measurement stimuli. So, both the sample and the comparison stimuli were units of measurement used in training. These included distance to weight, volume 1 to volume 2, distance to volume 1, and weight to volume 2, respectively. The background color was gray, and they received no auditory feedback and no longer had access to the progress bars. The transformation task checked to see if colors from training had reemerged with 3 different size squares presented horizontally on the screen. After completing the testing and transformation task, the data were reviewed, and if the participant failed to meet 90% on any testing phase, both relations were trained in the same fashion as the training phases. The next 5 slides offer you a complete list of our training stimuli, an example of our testing stimuli, and an example, and our transformation tasks with the 3 conditions.
The multiple baseline graph displays the results for Timothy, Carson, and Kevin in the phases of baseline, testing, and transformation task. As the graph displays, none of the participants achieved 50% or higher of correct responding on 2 out of 4 criterion blocks in the baseline phase, which allowed all of them to remain in the study. Only Timothy achieved 90% or higher of correct responding in the testing phase on all criterion blocks, which allowed him to immediately move on to the transformation task phase. The other 2 participants had to be retrained and retested in at least 2 criterion blocks in order to reach 90% or higher of correct responding before being allowed to move on to the transformation task phase. And as the graph displays, Kevin was the only participant to achieve the criterion for the transformation task, which basically just states that the contextual clues of blue, red, and yellow did not transform to novel stimuli of sizes in various squares for Timothy and Carson. These 4 graphs display the percentage of correct responses for the 4 criterion blocks in the training phase. All 3 participants were able to eventually meet 90% or higher of correct responses and eventually move on to the testing phase. These graphs display the average percentage of correct responses in the 4 criterion blocks of the baseline and testing phases. As the results indicate, there was a drastic improvement of percentage of correct responses from the baseline phase to the testing phase, and all 3 participants met the criterion of 90% or higher of correct responses to move on to the transformation task phase. This graph displays the average percentage of correct responses in the transformation task phase. Kevin was the only participant to meet the criterion of 90% or higher of correct responding, and the other 2 failed to do so.
There were several limitations to our study. One being that the stimuli may have been too prevalent in the everyday lives of the participant, given that 2 out of 5 participants actually scored 50% during baseline phases. Also, not all the phases contained the same amount of trials, which could have inhibited the amount of training each participant received on each discrimination. Future research should look into the different types of feedback delivered, maybe different sounds. Also, future research could possibly look into providing a more frequent breaks, because the study took an hour per participant.